Hi there. This video is an introduction slash update on the resources and reports we're providing to support weight management. And recording this, the new QOF rules have just been published and so on and made available in System 1. And there's a big focus now on obesity. And lots of the work we were doing before is really useful, but we've done quite a lot of updates to make it reflect and work better with the QOF rules and the new QOF targets. So in this video, I'm just talking through briefly how that all works and the reports in here. Some of these were here previously. So things like a weight that's zero ought to be marked in error. And we've got our retrieve, record and save, which is for calculating BMIs and then sending messages. But there's a big difference now. If you've got the messages enabled, one big difference is that we are now sending patients a slightly different questionnaire if they're entitled to NHS digital weight management. So one of the requirements of QOF is that all the options are presented to the patient. And so we've differentiated between those who can only access local weight management services and those who could also access NHS digital. So that changes the message. The other significant change is what happens if patients say they'd like to be referred. So previously we had some automations that would then send patients the information to refer themselves to local weight management services. Now it might be for some practices that's still necessary. It might be that some local services will only let patients self-refer, but we think it's more in keeping with the QOF rules that the practice does the referral. So we've got this new report here. These are patients who are entitled to local weight management service only, or they might also be entitled to NHS Digital, but they said they would prefer to access the local services. So they need to be referred. The code is in the report name. It's also available on our updated weight template. You also got referred to NHS Digital Weight Management. Patients have to be referred to access that. One of the key things as well with all of this is the timeframes that QOF now works to, which is that these referrals need to be made within 12 weeks, 3 months of the BMI being recorded. And you can't just redo the BMI. It's looking at the earliest BMI in the sort of process. So a few things we've done. Those need to be kept on top of in a fairly timely manner because we don't want to miss that 3-month window. What we've also updated and done newly now is new messages and reports for bulk texting patients with weight management options. So if they tell us their weight on questionnaires and you've got the right automations enabled, they'll go into the retrieve and save. Our system will calculate the BMI and then send the relevant message, assuming that that's appropriate for that patient. But if it's, say, done in clinic or for some reason that message isn't sent or you've not got that automation, then there are these two options for bulk sending messages. And these work on the time frame of a BMI in the last 8 weeks. So our thinking here is that we want to make sure we've got a chance to give patients the opportunity to respond and for us to then refer them within that sort of 3-month window. So by working to 8 weeks, if you regularly send these out, we're coding both that we're signposting them to weight information, but also the QOF code for the obesity invite is included in the preset. If they respond, they can say they don't want to take part, and that codes that as a decline, that's fine. And if they don't respond to 2 invites, then effectively that will treat it like a decline, same as any other QOF invite codes that are added. And if they want to be referred, then once you refer them, that will achieve the obesity 4 target. And we've also provided the letter equivalents, and they'll be available to use in the same way, though the NHS digital one we've had a bit of debate about, because if they're not able to receive a text, they may not be appropriate, but then they might not have opted out for text messaging, but have a PC or a tablet or something at home that they can use. So it's probably best to offer all the options to those patients. The other indicator, of course, is OB005. So we put that under the clinical review heading. So those are patients who've had a BMI in the last 8 weeks that meet the criteria to be eligible for the whole wraparound service and the pharmacotherapy and so on. We think those are probably patients that are likely to need appointments or at least some discussion and review. So they're in that category, and then you would use the template to say, code what's going on, or it might be to say that you want the patient to be invited. We also will be giving the option to say if you want those patients to always be invited, then the system can work in that way for these two clinical review categories. We'll look at the template in a separate video. It's likely that we'll develop some of this more over the next year or two, I suspect, but we hope this is a good starting point to help support practices with these new indicators. Any questions as ever, any feedback, please do let us know, and we hope we can help you with it. Thanks very much.